Hi everyone, I'm Cydney Hill. I'm 16 years old and I'm Miss District of Columbia's Outstanding Teen of 2014. I would like to talk to you today about my platform, which is empowering young survivors with breast cancer. This platform is really dear to my heart because my mom is a 3-time breast cancer survivor, and I feel as if it's really important to do self-breast exams because that's how she found her breast cancer each time. I'm here today at Georgetown University Hospital, Orisman Breast Center for Women. And I'm here to speak with one of the breast surgeons here, Dr. Bridget Opong.
Well, for first thing, Cydney's congratulations on your crown.
Thank you so much.
You're not only gorgeous, but you're also very intelligent.
Oh, thank you.
I'm very excited that you're here today, and I'm glad that you've picked up this platform to promote and to educate women on. Specifically on breast self-exams, it's something that I encourage women really of all ages to do, because just like you said, it can be a way to detect important things in the breast, like your mother and her history of cancer.
So Dr. Opong, can you explain to us the proper way to do a self-breast exam? Because I see we have information here on how to do it in the shower and other places, but can you explain how to exactly do a self-breast exam?
Sure, absolutely. You can see here on this card, and we give this to a lot of the women, and it's something, you know, you can put in the shower. I mean, because everybody showers every day, I hope. So this is something you can have with you, and you know, you can just pick what makes you comfortable. Some women choose to feel, you know, just palpate the breast in a circular pattern, or some women do up and down. There's lots of different ways here. Okay. And this demonstrates 3 different styles of whatever makes you comfortable. And the key is to do it when your arm's raised, because that's when you get the full sort of surface of the breast.
Okay.
All right. And as far as the timing is concerned, I advocate doing this usually away from your cycle, at least 7 to 10 days, because around your menstrual cycle, the breasts are typically stimulated and they get hard, or, you know, concern of lumpiness. They feel more nodular.
Oh, I did not know that.
Yeah, so it's important that you don't do it around that time, because I had a lot of women call and say, well, you know, I feel certain things and I feel changes. Then I said, well, is it around your menstrual cycle? And oh, yes. So it's important that you do it at least 7 to 10 days after your cycle, and to try to do it around the same time every month. Well, I think lastly, I just want to sort of demystify the whole thing of self-exams. Okay. It's not something that should be anxiety-provoking. It's not something that it should be stressful. You know, just all women have breasts. Feel comfortable with your breasts, and again, it can be life-saving. So I highly encourage women to just be comfortable with themselves.
Okay, now when you have women who do have that anxiety and get stressed out, is there anything you can suggest for them to help with that?
Well, what I usually do is when I have them in the office, I go over specifically how they should do the exam, and I have them touch their own breast. And I'm amazed at women who don't do that, or they're not comfortable touching, you know, their own breast. And I really sort of make them do it in real time, so that they do see that, oh, it's not a big deal, or oh, it's not that hard. And it really isn't, but it's a lot of anxiety around it, and there's a lot of, you know, misconceptions. So once again, I really commend you for, you know, advocating for this topic and just working to empower women, because it's really necessary. Right, and it's a medical need, you know, so just to, again, women to move away from that is nothing perverse about it. It's a medical necessity, and we encourage it. And all breast surgeons in my field, you know, we have seen women as young as you in their teens who develop breast cancers, you know, and so even the youngest women can have problems in the breast. So it's very important that we all do this.
And I have questions here for you today.
Sure.
So number 1, what pertinent information can you give to teens with a sick parent like mine dealing with breast cancer?
Well, I think it's important that you express your anxiety and your concerns, because when you're with somebody who's going through an illness, you may not know the extent of the situation. You may have some concerns or some fears that may not even be necessary. For example, if you don't know the type of cancer that it is, the type of illness that it is. So I think it's important to have an open communication with your parent so that you have an understanding of what's going on.
Okay. Question number 2. How often do you get patients that find their lumps in their breasts by doing self-breast exams?
We find this very frequently, especially in younger women, because the standard screening age where we're having women get their mammograms is about 40. So we see, and frankly, we see cancers in much younger ages. The youngest patient I have currently is in their 20s. So this particular individual is not somebody who their cancer would have been found on screening. So she found this on the self-breast exam. So it's very important that women still continue to do this and just overall be familiar with their own breasts.
Okay, question number 3. Do you often get patients that get too overwhelmed or stressed out from being diagnosed with breast cancer? And if so, do you usually suggest therapy or certain treatments to help calm them down?
Absolutely. I mean, it's a stressful time. You know, a lot of my patients have families, young children. It's just so many things that they're dealing with, and then you have this diagnosis, and everything pretty much has to stop. So for a lot of what I do is not just the surgery part. I have to really be mindful of the patient's overall, their situation, their home situation, their work situation. And we have a lot of resources, and you mentioned counseling, and that's a perfect example of something that women can utilize throughout all phases of their cancer treatment just to help them deal with the diagnosis.
Okay. Number 4. Do you get a lot of teen patients my age diagnosed with breast cancer, and if so, when exactly did that start?
So that's a great question. Breast cancer is typically a disease of older women. We don't see many young patients, and particularly in the teens, I've seen in the last 4 years only one patient who's about 19. So wow. It's very unusual in somebody in your age group. But that doesn't mean that, you know, I don't want women in your age group to be aware of the disease. You should be aware of just your breast in general. There are other things that can happen in the breast, not necessarily cancer, but there are other things, other benign conditions that are much more common in young women your age. So I do have a lot of young patients, and they're not seeing me for cancers, but there can be other types of lumps, usually non-cancerous, that we can see in younger women. Stay positive, because I always tell patients, you know, it's 50-50 the treatment that you get, but also what you bring to the table, meaning your attitude, your positivity, how you view yourself and your life going forward is really important. You know, if you take 2 patients with the same type of disease, if one patient is depressed and negative and just overall in a lot of psychological distress, they're not going to do as well as a person who chooses to be positive, who chooses to be empowered, and who chooses to live with the cancer, or, you know, have more of a fight in them than someone who just comes in defeated. The reason that I do what I do is I want to treat women because I want you to live your life. I want to get you back to doing the things you used to do. So that's our goal. Especially somebody that young, I would do my best to make sure that they're not missing anything that, you know, that they were doing before. That they should continue being a teenager.
Thank you, Dr. Opong, for taking time out of your day to explain to us the importance of self-breast exams.
Well, it's been an absolute pleasure, and again, I commend you for what you're doing. And I put together a packet of information for you, because as you go into the community and you're working to educate women, I want you to have some materials to take with you.
Thank you so much.
You're very welcome. I'm more than happy to talk to you anytime.